Hello, and thank you for watching your BDG Trees Open Enrollment video. The benefits we'll be discussing today will become effective September 1st, 2016 through August 31st, 2017. All employees will have access to a copy of the benefit guide. If you do not have access, please contact your human resources so they can provide you with a copy or have one emailed or mailed to you. Refer to this list when you need to contact one of your insurance carriers. For medical, the provider name is Blue Cross Blue Shield of Texas. Group number is 167-395. Phone number is 1-800-521-2227. And the web address is www.bcbstx.com. For voluntary dental, the provider name is Unum. Group number is 691-251. Phone number is 888-222-2685. And the web address is www.unumdental.com. For employee-only basic life and AD&D, included with medical only, provider name is Dearborn National. Group number is F015496. Phone number is 800-348-4512. And the web address is www.dearbornnational.com. For your HSA account, provider name is HSA Bank. Provider phone number is 1-800-357-6246, and the web address is www.hsabank.com. Welcome to your benefits. BDD Trees offers excellent benefits to eligible employees and their dependents. Your benefit needs are unique and important. Our program is designed to be comprehensive and flexible so you are able to choose the benefit that makes most sense to you and your family. This Benefits Enrollment Guide is a reference tool that contains a basic overview of the benefit plans offered by BDD Trees. This guide is not intended as a contract between you and BDD Trees. The summary plan description and contract are legal documents controlling eligibility and benefits under the plans. In the event of any conflict, the legal documents shall be binding and final. Individual mandate reminder. Beginning 2014, the Affordable Care Act requires every individual to have health coverage or pay a penalty. All plans offered by BDD Trees meet the ACA requirements. Therefore, if you do not enroll in medical coverage, you will be subject to a penalty greater of $695 per adult or 2.5% of MAGHI times the amount over the filing threshold. The individual penalty is scheduled to increase on an annual basis. Acceptable coverage includes the health plan offered by your employer, your spouse's employer, coverage purchased through Health Insurance Marketplace, as well as government programs such as Medicare, TRICARE, and Medicaid. Who is eligible? If you're a full-time employee working 30 hours or more, you are eligible to enroll in the benefits described in this guide. Your spouse by marriage or tax-dependent children are also eligible for medical, dental, and basic life and AD&D coverage. Please note your eligible dependents may also participate, for example, grandchildren who are claimed on your tax returns. When do you become eligible? You are eligible for benefits on the first of the month following 60 days from your employment date. How to enroll. Once you have selected your coverage, you will not be able to make any changes until the next open enrollment period unless you have a qualifying event. We will go over the open enrollment form at the end of this video. The open enrollment period is August 8th through the 19th of 2016, and the coverage effective date is September 1st through August 31st of 2017. How to make changes. Unless you have a qualified change in status, you cannot make changes to the benefits you elect until the next open enrollment period. Qualified changes in status include, for example, marriage, divorce, legal separation, birth or adoption of a child, change in child's dependent status, death of a spouse, child or other qualified dependent, change in residence, commencement or termination of adoption proceedings, change in employment status, or change in coverage under another employer-sponsored plan. What's new in 2016-2017? Key items to note: voluntary dental passive PPO is now offered, and employee-only basic life AD&D when you enroll in medical. Definitions of key insurance terms. Copay, a standard amount you pay out of pocket when you go see a primary care physician, PCP, a specialist, fill a prescription, or go to the urgent care clinic. Deductible, The amount of money you will pay each calendar year before any coinsurance applies. Services subject to the deductible include, but may not be limited to, inpatient hospital services, some outpatient care, and complex imaging. The deductible is based on the calendar year and starts over each January 1st. The family deductible is the same no matter how many dependents are on your plan. In-network or out-of-network. This describes whether the doctor or facility is contracted with Blue Cross Blue Shield of Texas. Blue Cross Blue Shield negotiates with doctors and facilities to provide services to their members at deeply discounted rates. If you see an out-of-network provider or visit an out-of-network facility, you may experience much higher out-of-pocket expenses. We highly recommend that members call the number on the back of their ID card to confirm the doctor you want to see or are referred to is contracted with Blue Cross Blue Shield of Texas Blue Choice Network. Coinsurance. For services exceeding the deductible, members are responsible for sharing a percentage of those eligible expenses with Blue Cross Blue Shield of Texas. The services you receive will still be deeply discounted as long as you utilize an in-network doctor and/or facility. The coinsurance limit refers to the maximum you will pay out of pocket in any given plan year in addition to the deductible. Coinsurance limits differ between in and out of network. Out-of-pocket maximum. The most you will have to pay for covered medical expenses in a plan year through deductible and coinsurance before your insurance plan pays 100% of covered medical expenses. Explanation of benefits. This is the detailed description of services you receive for services rendered. EOBs are generally mailed to the member at their home. An EOB will outline the dates of service, what services were provided, who provided them, and where they were rendered. It will also show you the original submitted charge, the discounted allowable charge, what the plan paid out for these services, and the member's financial responsibility, if any. Please note, an EOB is not a bill. Preventative care services. These services include immunization, routine and annual physical exams, well baby exams, vision exams, and any other preventative health services determined by the USPSTF, U.S. Preventative Task Force. Some tests and health screenings are based on factors such as age, gender, overall health status, personal health history, and your current health condition. Preventative care services should be covered at 100% per the Patient Protection and Affordable Care Act if services are rendered by a contracted physician and facility. As long as the care provided is coded as preventative and not diagnostic, you should not have any out-of-pocket expenses, not even a copay. Prior authorization. Prior authorization is a process of determining benefit coverage prior to the services being rendered to an individual member. A determination is made based on medical necessity for services, tests or procedures a provider facility would like to perform. This member-centric review evaluates the clinical appropriateness of requested services in terms of type, frequency, extent, and duration of stay. Medical triple option. The following chart provides a highlight of the benefits effective September 1st, 2016 through August 31st, 2017. For the base HSA plan, your physician visit and specialist visit is 20% after deductible. For enhanced PPO, it's $35 copay for physician visit, $65 copay for specialist, and for the premium PPO, it's $30 copay for physician and $45 copay for specialist. Please note that a specialist referral is not required for any of these plans. For preventative care, there is no charge on any of the plans listed. For urgent care, base HSA, you would pay 20% after deductible. For the enhanced PPO, you would pay $75 copay, as well as on the premium PPO. For emergency room on the base HSA plan, it's 20% after deductible. And the enhanced PPO, it's $200 copay. And for the premium PPO, it's $150 copay plus 20%. Please note there are many facilities that look like an urgent care, however, are emergency rooms. That is why we recommend to look up urgent care locations when you are healthy and not under any stress and/or pain. Please use your best judgment when deciding what type of care to choose. Your deductible for individual under the base HSA plan is $5,000 and for family it's $10,000, as well as the enhanced PPO. For premium PPO, the individual deductible is $1,250 and the family is $2,500. For hospitalization, diagnostic tests, and imaging under the base HSA plan, it's 20% after deductible. For the enhanced PPO, it's 0% after deductible. The premium PPO is 20% of allowable amount for hospitalization, 0% after deductible for diagnostic tests, and 20% after deductible for imaging. For your pharmacy out-of-pocket maximum, your individual and family for your enhanced PPO and premium PPO plans is $1,000 for individual and $2,000 for family. For prescription drugs in your base HSA plan, it's 20% after deductible for generic, preferred brand, and non-preferred. For enhanced PPO, it's a $15 copay for generic, $35 copay for preferred brand, and $65 copay for non-preferred. For the premium PPO, it's $15 copay for generic, $35 copay for preferred brand, and $50 copay for non-preferred. For more information on your HSA account for your base HSA plan, please refer to the pages 8 through 10 in your benefit guide or contact your HR department. How to locate a doctor on Blue Cross Blue Shield website. Go to www.bcbstx.com, click on Find a Doctor, choose Blue Choice PPO plan as your network, then search by name or provider type. For voluntary dental, BDG Trees allows you to seek treatment for the dentist of your choice. You may choose any dentist, however, using dentists participating in the network should lower your out-of-pocket expenses. You can find a list of participating dentists at www.unumdental.com. The calendar year deductible you would pay for individual is $50 and for family it's $150. For calendar year benefit, it's $1,000. Preventative and diagnostics such as cleanings and x-rays is covered at 100%. Basic services, 80%. Oral surgery, 80%. Periodontics, 80%. Endodontics, 80%. Major services, 50%. And orthodontia is not covered. Employee-only basic life and AD&D insurance included with medical plan only. BDG Trees provides full-time employees $10,000 group life and accidental death and dismemberment insurance if participating in the medical plan and pays the full cost of this benefit. Contact Human Resources to inquire about the amount of your coverage or to update your beneficiary. The life and AD&D amount reduces by 35% at age 65 and by 50% at age 70. Basic life and/or basic AD&D may be eligible to be converted. Please refer to the information on portability and conversion in your insurance certificate. Actively at work. Please note, certain benefits include an actively at work provision that require you to be actively at work on the date of the coverage when it becomes effective in order for you to be eligible for benefits. The benefits subject to the actively at work provision include basic life and AD&D. Please refer to your certificate of coverage for more information regarding these restrictions. Here you will see your benefit cost pre-tax. Your weekly cost for your base HSA plan employee only is $16.66. For employee and spouse is $106.22. For employee and child, it's $82.68. And for employee and family, it's $184 with 80 cents. For the enhanced PPO, employee only, $21.28. Employee and spouse, $118.80. Employee and child, $91.81. And employee and family, $213.73. For premium PPO, it's $32.70 for employee only. Employee and spouse is $159.72. Employee and child is $123.76. And employee and family is $279.74. For voluntary dental, employee only, it's $627. Employee and spouse, $1256. Employee and child, $1176. Employee and family, $1995. Insurance beneficiaries. It is important to keep your beneficiary designation up to date. This helps to ensure your benefits get to your chosen recipient in a timely manner in the event of your death. As a general rule, you should review your primary and contingent beneficiary designation annually or whenever you have a major life event such as marriage, divorce, birth, adoption, etc. Portability and conversion. If you retire, have reduced hours becoming ineligible for benefits, or terminate employment with BDG trees, you may be able to take your life coverage with you, subject to the restrictions and limitations of the plan. You must request the option to convert your basic life coverages within 30 days of termination of employment or loss of eligibility for coverage. Please contact the carrier of your Human Resources Department for more information and proper documentation. Waiver of premium. If you are totally disabled and your insurance coverage ends, you may be eligible to continue your life insurance, AD&D not included, without payment of premium. This is referred to as a waiver of premium provision. Please refer to the waiver of premium provision in your life certificate to determine if you are eligible for this benefit. You may also contact Human Resources for more information. Here we will go over your 2016-2017 open enrollment form. In the first section, you will see your enrollment. You will select your enrollment. So it would be either open enrollment, new hire, rehire, reinstate, or late enrollee. Third line would be remove and or terminate. You can either remove spouse or child, employee termination, cancel coverage, or COBRA. The last line would be change, which would be add spouse or child, name change, address change, or other. In section A would be employee information. All information is required. You would fill in your last name, first name, middle, social security number, birth date, date of hire, home phone, home address, city, state, zip, marital status, and gender. Plan B, you have your plan selection with weekly rates illustrated. You will see your base HSA, your enhanced PPO, your premium PPO, and you will select what tier you would like, whether it's employee only, employee and spouse, employee and children, or employee and family. If you would like to decline or waive the coverage, you can do so by selecting one of the boxes on the right. Voluntary dental, weekly rates as well. Select the same tier, or select the tier you would like: employee only, employee spouse, employee child, or employee and family. And you also have the option to decline and or waive. The section below that would be where you would list any dependents. You will add A to add under action, C to change, or T to terminate. You will fill in their name, sex, birth date, social security number, and if they have any other health coverage. Under the health savings account portion, please complete and use calculation example below. If you're electing this option, amount may be less if not participating for a full 12 months, and you must be enrolled in a high deductible health plan in order to contribute to the HSA. Here we have section D, employee only life insurance beneficiary for $10,000 for those enrolled in medical. You must select your beneficiary, and this would be the person to receive payment if you die while covered by the plans. Please make sure you also name a contingent beneficiary, also known as a second beneficiary, and that would be the person to receive any proceeds in the event that the primary beneficiary is no longer living. Please make sure your beneficiary designation is clear so that there will be no questions as to your meaning. And remember that if naming a minor as a beneficiary, a trust account will need to be established and could cause some delays in receiving benefits. It is recommended that a trust account be set up before to avoid delays, or to name someone you trust who will look after your beneficiary. Section E would be plan declaration. Section F, notice of special enrollment periods, and G would be your signature and date. Once you have completed your open enrollment form, please turn it into your HR department. For questions about your benefits, please contact Human Resources or call the phone number located on the back of your insurance card. Thank you and have a wonderful day.